Hello everyone, my name is Alice and today topic is gonna be HIPAA compliance. HIPAA, which stands for Health Insurance Portability and Accountability Act, is a federal law governing the privacy of the patient's information and security of the PHI. HIPAA is not just a regulation for occupational therapy, but is also a necessary best practice to protect the information we come across in practice. Strict compliance with HIPAA rules is essential to protect the privacy of patients' information to avoid exposure or release to unauthorized individuals. However, if an individual or company fails to adhere to the guidelines of the HIPAA, they are subjected to severe consequences including penalties and fines, which may cost them their professional reputation. HIPAA compliance is important because it ensures that the patient have confidence in the treatment they are to receive from the medical practitioners. Implementing HIPAA can be quite easy if one breaks the process down into 5 steps. A good place to begin is by establishing routine security risk assessment to identify any potential gap in your practice data protection measurement, such as the use of findings to establish an executive remediation plan to fix any of the areas highlighted. Third, develop a specific HIPAA compliance policy and procedure for your practice and check that the information is updated. It is important to train all of the staff at least once a year to ensure that everyone is aware of HIPAA rules and regulations, as well as to update them if there are any changes. Also, make sure that business association agreements are made with all the vendors who work with the organization and have access to the PHI to ensure that they will follow the rules of HIPAA. Lastly, but not least, it is important to have sound incident handling policy and measures that can be followed in case of any violation. As an occupational therapist, there are several key HIPAA regulations that you must strictly adhere to. Firstly, obtain written consent from patients before sharing their protected health information. Is a legal requirement ensuring that the patient have control over their personal data. Securing electronic personal information is equally important, which involves using encryption, a strong password, and firewall to prevent unauthorized access. Regulation and documented staff training is essential, as it keeps everyone in the practice informed about the practices of HIPAA compliance and how to handle personal health information correctly. Additionally, it is vital to develop HIPAA policies that are tailored to your specific practice and review them regularly to accommodate any change in your operation. Lastly, if the data breach occurs, immediate action is required to mitigate the damage and comply with breach notification requirements. Maintaining HIPAA compliance is an ongoing process that requires continued effort and vigilance. Regular risk assessments are crucial for identifying and addressing new vulnerabilities in your practice data protection system. Monitoring and auditing your compliance effort on an ongoing basis help ensure that your practice remains compliant with HIPAA regulations. Additionally, it is essential to have a well-prepared incident response plan in place so your team know exactly how to react if a data breach occurs. As your practice evolves, regularly update your HIPAA policy and procedure to reflect any change in your operation. By addressing to this best practice, you not only meet legal requirements but also build and maintain trust with your patients, assuring them that their personal and medical information is handled with the utmost care.